We all know how important it is to place the probe tube correctly inside the ear canal. On one hand, we don't want to put patient through discomfort by touching the patient's eardrum, and on the other hand, we know that a too shallow probe tube placement will give you incorrect results. We have a tool to help you with that.
Let's see how we can use OtoSuite and AURICAL FreeFit to place the probe tube correctly in an easy way. We assume that you have carried out a visual inspection of the client's ear canal and eardrum, making sure everything is normal. We also assume that your AURICAL FreeFit is switched on and that you have made the probe tube calibration and navigated to freestyle within PMM. Here are some hints before starting the procedure. We will be trying to locate a notch on the gain curve in the frequency range from 4 kHz and up. The position of that notch indicates the position of the tip of the probe tube, and we want to make sure that we push the probe tube into the ear canal so that the notch no longer pulls the measurement curve downward. We have made a user test that configures one of the buttons in the OtoSuite for the probe tube placement procedure. Let's bring that up. First press F8 or click the test selector icon on the toolbar. Now click on the user test called probe tube placement. OtoSuite is now set up. Before we click the start button, please make sure that you hold the probe tube firmly and then you either have access to the black ring of the probe tube or the probe tube support. This will ensure that you can position the probe tube correctly later when you will be placing the hearing instrument onto the patient's ear. Now click the probe tube placement button and insert the probe tube less than halfway into the ear canal. Now you will see a notch at approximately 4 kHz. Gently insert the probe tube deeper while keeping an eye on the notch which is moving towards higher frequencies. The probe tube is located correctly as soon as the notch is no longer dragging the measurement curve down at 10 kHz. Now's the time to move the black ring into position or attach the probe tube onto the probe tube support. You can stop the measurement now. We suggest you practice this procedure on a coupler before using it on patients.